Hello guys, this is Jonathan Munoz, and today we're going to talk about antibiotic stewardship and how could this be of use for you during your interviews, rotations, and the knowledge that this will provide to you, okay? So let's start by saying that why am I recommending for you to choose an angle that may be related to antibiotic stewardship? What is antibiotic stewardship? Antibiotic stewardship in the United States means the proper use of antibiotics in a evidence-based way. Now, it's very simple. It's simpler than it sounds. Basically, every hospital in the United States, especially those that are academic centers or trauma centers or those big community hospitals, will have an infectious disease doctor in the hospital. They will have an antibiotic stewardship program where they recommend or they monitor doctors, residents that use orders for antibiotics and how they use it. The most common thing for a resident, for a doctor that doesn't want to think from the get-go is to, by default, putting a patient on vancomycin and Zosyn. Now, hospitals and the medical healthcare system have seen that there is an overuse of broad spectrum antibiotics when the initial pathology didn't call necessarily for that. And they recommended for every hospital to try to decrease the use of potent antibiotics, not only for to avoid antibiotic resistance in the long run, but also to prevent complications such as Clostridium difficile infections, which are raising and they are affecting more and more the elderly. So these programs, they recommend you to use what is called the antibiograms and base your decisions on a proper study or reasoning of what is coming to your hands. Let's say a patient with an elderly female is coming to the hospital with signs of dysuria, and the urine analysis shows some signs of pyuria. The white blood cell count's elevated. She has all the symptoms. There is abdominal pain. She had dysuria. She had a fever. So for all symptoms, we are on sepsis. Now this patient comes from home. She hasn't been catheterized before. So what could be the best option for her? Piperacillin tazobactam, or could you start with ceftriaxone? And so the guidelines recommend you to try to narrow your options and select based on these the most common or possible bacteria causing the infection. So for this patient, I would choose ceftriaxone. But let's say this is a patient that comes back from a nursing home, or she has been multiple times in the hospital. In the past, she had a urine culture that was positive for ESBL, E. coli. Then the antibiotic choice will be different. So they recommend you to use this kind of thinking. So how will the antibiogram help you? For example, let's say this is a hospital website, and you go to most of hospitals that you will do rotations, observerships. They will have this access, this antibiotic or antimicrobial stewardship program, different names in different hospitals. So I will show you this one. I will show you the UCLA one, so you can have one to compare. But for example, for this one, this is a community program. So they have on the antimicrobial stewardship program, they have antibiograms 2020 to 2016. They have an empiric infection sepsis guide. And they have a couple more things, but let's go and take a look on the antibiogram from 2020. What it says is, in case you find a possible E. coli infection in urine only, the more likely antibiotic to work for this one is, very likely to work is piperacillin tazobactam. What about other options? Ceftriaxone in there too, 86 compared to 96 on piperacillin tazobactam. Ceftazidime, very, very high, but is ID restricted, which means is that this hospital requires that if you're going to order ceftazidime, you need an infectious disease consultant. And how could this be of use for you? Not only that, on the interviews, you could say, during interviews, you could say, I have an interest on antibiotic stewardship. I find myself working well with the infectious disease team on assuring that there is proper use of antibiotics to prevent not only Clostridium difficile infections, but to prevent antibiotic resistance in the long run in our community. And I like to always emphasize that proper use of the antibiotic antimicrobial guide, antibiogram, is a good practice to narrow down your antibiotic selection. That is for, let's say you have an interview or you are doing an observership, but let's say you are in the middle of a presentation of a case in your observership, and you have a case, and it's the lady that I just presented. And so your attendant tells you, present this case. What is your assessment and plan? So problem number one, sepsis due to UTI in a female patient with XY conditions. I think the more likely infection agent is gram-negative bacteria, possibly E. coli. Based on the antibiogram that we have available in this institution, one of the possible options is ceftriaxone. With this, we could start the treatment and we could wait until the urine cultures are completed. That's enough. That's enough for a good plan. And it's based on the evidence of available information in your system. And not only you're showing that you know how to find this information, you're showing that you're using evidence-based medicine, and you are showing that you're able to narrow down antibiotic selection. So that would be for interview, observation, or observerships, and you can see all the antibiotics that are available. For example, for ciprofloxacin, the percentage, the susceptibility changes and decreases. Same for levofloxacin. This is something known that fluoroquinolones have more and more resistance, and this is increasing. So this is one antibiogram. Every hospital has a different one. So now let's look at the UCLA antibiotic guide. Bang. So you can find these two. Look at the website here, resident mednet UCLA edu.antibiotics guide. I don't know how I got this. I think I got it when I was doing residency like 10 years ago, but it is often updated, and it is commonly used by these residents, and a lot of the residents I know use this because the information here is really good. So let's see what they say. So they have this whole website about antibiotics guide, and why. Then you can see now that how important this is for any hospital program. Now, if you look at this, they have, during which part is important for us is you have to go to antibiotic overview and a specific treatment of select bacterial organism at UCLA. So that will be their antibiogram. So for this, you can see how, if you look at an organism, for example, let's try to find the E. coli. E. coli, where are you? Here, E. coli. So ESBL and just E. coli. For E. coli, they recommend ceftriaxone, cefazolin, cefepime. For ESBL, ertapenem. And they also have a line that says that this is first line treatment. Alternate treatment will be fluoroquinolones, but now you know that fluoroquinolones have more and more resistance. So this is the antibiotic stewardship angle that I was talking antibiotics, infection disease, hospital acquired infections are very important for healthcare systems because not only you're using less potent antibiotics, which means that these are um, less harmful, and not only you're saving money on using um, less potent antibiotics, but you're also preventing Clostridium difficile infections. You're also preventing GI problems, and overall, if a hospital is able to demonstrate that they are following guideline directed therapies, then different quality markers change. So this is what I had for you today. It is the antibiotic stewardship angle that I was talking about. Hopefully, you are able to use these for as part of what you are going to show during your observerships or interviews and have a good experience there.